Hello, stroke warriors and families everywhere. Welcome to another therapy show. Today, we're going to talk about occupational therapy with Jacqueline D'Aries. Uh,
Yes, you got it.
okay, and you're at what's the name of the company again?
Holistic life skills.
Holistic Life Skills. I like that.
Mhm.
Well, let's talk about first. Can you share a little bit about your background and what inspired you to become an occupational therapist, particularly with stroke survivors?
Yeah, sure thing. Thanks for having me on here to chat.
Well, welcome.
Yeah, thanks. So I've been an OT for about 10 years now. I
Okay.
first got into it a while back. My sister's a speech therapist. So when I was hunting for a career, she said, you should come to the hospital and check out all the therapies. So I said, sure. And you know what? She actually worked with kids. So I saw like the OTs playing with kids and I said, I could do this. So it was fun. But then, of course, turned out I never even worked with kids. I ended up falling in love with the adult neuro population. So
Okay.
I ended up specializing in all things acquired brain injury, strokes, traumatic brain injuries, things like that. And I found the brain just to be so fascinating. You know, every single brain is different. So
Yeah.
my job is never boring, right? And
Yeah.
it's not like dealing with the same orthopedic knee. Everybody's different. So it's very enjoyable for me. It's fascinating.
Wonderful. What are some of the unique challenges that most stroke survivors face that differ from regular patients, quote unquote, regular?
Yeah. I think one thing that's really specific to even any type of stroke or brain injury is that it's so unexpected, right? You go through life never expecting that you're going to have a stroke. And one day, all of a sudden, your life is turned upside down. And, again, it's not like having an orthopedic surgery, you kind of know it's coming. You have
Right,
pain for a
right.
while, you know. But with a stroke, you don't ever expect it. And it's such a life change. All of the things that you love to do all of a sudden are impacted. And so I love to try to help people through that because it's also like this identity crisis, that a lot of people go through. And I love to help people, get back to doing those things that they love and finding new things that they love along the way.
Nice. How, occupational therapy, I didn't know much about it until 6 months after my stroke. For example, I didn't know that I needed handwriting help. I had to
Mhm.
relearn how to write. I didn't know that occupational therapy had something to do with helping with organizational skills and the daily life skills. I didn't learn a lot about that until 6 months, and some of it I didn't learn until a year ago. And I'm 9 years post stroke. So I mean, how do you assess the needs of a stroke survivor when they begin?
Yeah, it's a good question, and that's a shame, first of all, that you didn't even know what OT does. Like that's a mistake, on our healthcare system's part that you didn't even get access to OT services until that late. They should be starting day one.
Yeah, and part of it is I think a lot of us, and in my case, and maybe it's silly, but I thought occupational therapy was about jobs.
Yeah, but that's what makes sense, right? Because the language, when we talk about this all the time in OT school, and why is our language that way, right? Why is our career occupational therapy? But when you break it down, the occupation doesn't stand for work, it stands for things that occupy your time, right?
Right.
That's where that word comes from. So, what you asked about me, how I assess people, it always starts there, right? Like, what are the things that occupy your time? What do you do daily? What are the occupations that bring you joy? And it could be work, right? Work could be one of them, and it is for a lot of people, but it could also be playing tennis, or flying a kite, leisure activities. Um, for a lot of people that go through a stroke, of course, at first it's, I want to be able to dress myself, right? That's still a way that you occupy your time, you
Right.
carry yourself. So I always start my evaluations there. Like, what are your core values? What's meaningful to you? How do you like to spend your time? And then we go from there.
How do you, should you be referred to an occupational therapist, whether you, somebody like primary care physician or the hospital physician, shouldn't they be referring to you even if they don't know whether you need it or not?
I mean, that would be ideal, right? Because every treatment professional, even not just OTs, right? PTs, speech therapists, we have the certain eye, of things that we're trained in, things that we're looking for that maybe a doctor doesn't even necessarily know. I hope, and I try to do the best in educating people around me about what occupational therapy is. The more that doctors are aware of what it is, then they can refer when it's appropriate. But yeah, I mean, if you're in the recovery process and you're thinking, do I need an OT? Just seek one out, get an evaluation because they might be able to help you in areas that you didn't think they could.
Yeah,
So we look at the person
yeah.
very holistically. So
I
it
didn't realize that, for example, occupational therapists had some, in their training, they had some mental health training.
mhm.
That was like, wow.
Yes. Yeah, there are even OTs that work in just strictly mental health settings, like in prisons, just trying to work on people's mental health and things like that. So we focus, of course, my focus is on neurology, but yeah, we really look at the entire person holistically for treatment.
Can you explain the role of occupational therapy in a recovery journey? I mean, obviously, you've already touched on it with the ADLs. Would you explain that for us?
Yeah, of course. So, like I was saying, we focus on the things that occupy your time, right? Participation in things that occupy your time. So, in order to improve participation in these things, we look at the person holistically, like we said, physically, emotionally, cognitively. We take into consideration the environment that they're participating in, the family support required for them to participate in the things that bring them joy. So what we do as OTs is when we do our evaluation, we dive into all of those areas, and then
Mhm.
we say, okay, if your goal is participation in this activity, what areas of your person do we need to improve, in order to improve participation? So it
Okay.
could be remediating ability. If you, after a stroke, if you have weakness on one side of your body, part of it could be, okay, well, let's get that arm and that left side of your body working so that you can dress yourself with two hands. But then along the way, we could say, well, let's teach you also how to dress yourself with one hand because it improves participation, right? Improves
Okay.
independence.
Oh, I like that approach. What are some of the common goals for stroke survivors during OT, and how do you tailor those to each individual?
Yeah, well, usually when somebody, when somebody first has a stroke, typically their life is so impacted that they need to work on the basic skills, right? The basic dressing, brushing their teeth, eating. But so a lot of OTs will focus on that because that's usually what a lot of people, their goals are really they want to be independent and taking care of themselves. But again, it could be anything else that they want to do. So, I've had even some clients who just maybe because of their religious background, they don't really have desire to take care of themselves because it might be their wife's role, right? To maybe do some things. And if that's not their goal, then okay, what is your goal? Do you want to focus on financial management or like a hobby, caring for your pet, right? Like it could be anything that's
My
specific.
gosh, yeah, I never thought of it that way. I mean, financial management, what a great area to jump into. Um, could you share some of the therapeutic techniques or exercises used specifically for improving these skills or mobility or cognitive function? I mean, it's such a huge area. I mean,
Yeah, well, because it's so huge, it's kind of difficult to answer that question. I have a whole toolbox. That's what I call it. I call it my toolbox of skills. And I have a range, and depending on what the person needs, sometimes I pull some out of the toolbox, and if that doesn't work, I pull other things out of the toolbox. It's this endless toolbox that I've built over years.
it's really like I've always wondered. I go to physical therapy or occupational therapy 2 or 3 times a week in the beginning, and they do a different exercises each time. I would always think that you do the same things over and over until you get it. Uh, Explain that. Is that because of a lack of assessment, or is it just to really more or less assess the patient and see which things they're good at and bad at?
That's a good question. And so, what we always do, and I think the reason why you're experiencing the change is as therapists, we're constantly evaluating, right? It's never just we do an evaluation and then here's the treatment plan. Every time we see you for a treatment session, things could be different, right? You might be responding differently. And so, every time that I'm with a client, I'm constantly reassessing how they're doing. And generally too, when I do treatment, there are some situations where the repetition of the same maybe movement is important. But then there are also some situations that we need a little bit of variability so that people can generalize the skill, right? If you only focus on one skill and you do that over and over and over, like for example, if you sit down, like do a sit to stand from the same wheelchair every time, you get really good at standing up from that wheelchair. But what if you need to stand up from a toilet or a bed or right, different surfaces? So sometimes we like to throw in a mix of different treatments because we need you to start to be generalizing those skills and not just focusing in one area. Does that
Yeah,
make sense?
yeah, it does. I mean, the cognitive function in my case was I didn't realize some of the things I couldn't do. So I guess that was the big help, that you
Mm.
can recognize some of the things that you need to work on, which OT is so broad. If I've learned so much now that about OT being so broad, it's amazing to me what you guys can do.
That's what keeps it fun.
How do you help stroke survivors through the frustration and setbacks during recovery?
Mm. That happens often, almost every single one of my clients has frustrations. And what I usually do is immediately, it's always validating first, right? Because what you're experiencing, the frustration is totally normal. I would be frustrated in that situation, right? It sucks. What people are going through sucks, right? There's no way around that. But what I always like to say is you can have that feeling of frustration, but it's how you respond to that feeling. How you react to that feeling is what's important. So we have the feeling of frustration. Okay, let's experience that feeling, but let's try to move past that, right? Okay, yeah, that was so frustrating, but what can we do to move forward? How can we improve? And so I always tell people just remember how far you've come. A lot of people forget, right, how far they've come. So I'm constantly giving them tools to remember how far they've come. And a lot of people, that could be pictures or videos of how they were doing in the past. Sometimes I like to do like a goal time capsule with people. So, at this stage of the recovery, we write down where you're at functionally, we set goals, and then we roll it up and put it away for 6 months. And then in 6 months, we open up that time capsule and say, wow, look, 6 months ago, that's where you were. And look, you met all your goals. So things like that, and constantly reminding them, if they say I can't do something, you can't yet. It's a lot of power of language and
Okay.
power of, yeah, those mental processes to react to the frustration and not sit and spiral in it.
Yeah, I've, interesting you say that. One of my shows, or my favorite show, is Catch the Wave, Warriors Achieving Victories Every Day. It's
Mm.
those small victories that add up to the big ones,
Yes.
and I
Achievable.
just, once I learned that, it became so much better. In your experience, what factors are contribute the most to a successful recovery?
For sure, positive attitude. I've seen two people with very similar injuries, and if one has a positive attitude, they always go further than the person that doesn't because they're just willing to try, they're willing to not give up, they're empowered. And that's a huge part of it.
It's a choice between becoming a stroke survivor and a stroke warrior, isn't
You got it.
it?
Yeah,
Yeah,
I like that.
yeah. how do you involve the family or caregivers in the therapy process, and why is their role so important?
I think their role is one of the most important, of course, other than the person themselves. I always talk about, and the reason why I know we'll get into it, but the reason why I started my practice and the online community is because when somebody leaves the hospital, they don't have much therapy anymore, right? And who are they with the most? Their caregiver and their family. And so, if their family members can become therapeutic caregivers, understanding their loved one's deficits and how to help them progress, but also becoming the best caregiver, a therapeutic caregiver means taking care of yourself also, right? Like being able to have time for yourself, do your own self-care, right? So I would always tell my family members to strive to be that therapeutic caregiver in all aspects. And I always encourage to join the therapy sessions. Whenever the caregiver is around, I say, you come and watch and learn and be hands-on. So that, because when you think about it, the more the caregiver can help their loved one progress, it's going to improve the quality of life for everybody in that family, right? If
Yeah,
the person can be a little bit more independent, that frees up time for the caregiver. It improves everybody's quality of life.
yeah, it's that saying that I keep hearing, that not only the person has a stroke, but the whole family does.
It does. It really does impact everybody.
Yeah. Um, I'm your approach is uh, kind of unique because you do such a holistic approach. I always thought holistic was one of those designer things, because and it's just me. I have designer diseases and stuff that I think are, baloney. But yours, I'm interested in yours because you really get into a conversation, you get into a relationship with your patients, and it becomes a um, you the way you do it, I believe, and correct me if I'm wrong, is you make that patient captain of their own team.
Mhm. Yes, I always tell them you're in the driver's seat. I'm the passenger. I can help guide you and help direct you, but you're the one in the passenger seat. Yeah, so a
That
lot of it is education. I want them to be empowered, making decisions for themselves and wanting to participate in their own therapy and have ideas.
yeah. It's interesting because you take into consideration the how do I want to describe it? The mental aspect, the um, learning aspect. Is that a good assessment?
Yeah, you mean in terms of the emotional
Yeah, yeah,
or
yeah.
um
The emotional. Mental was the wrong word. Emotional.
yeah, we take into consideration, like we call it psychosocial factors. But yes, because when you think about it, your emotions and your mental health can impact so much, right? So, I would have, for an example, I would have a lot of clients post-stroke that have a lot of anxiety and maybe fear of getting back into the shower for the first time. And imagine if, say, during the therapy session, I said, no, come on, let's just do it. Just get in the shower, and didn't even take into consideration their anxiety, right? Then say we get in the shower, now it's going to be a poor experience. And now they've associated the shower with something negative. And so
Okay.
we have to consider their emotional well-being and say, okay, well, if you're anxious about the shower, let's break it down into smaller steps. Maybe we do a dry run in the shower. Maybe we transfer onto the shower chair and then we do nothing. Right?
Okay.
So considering the emotional factors are really important for somebody's success in their recovery.
Yeah, it's those small steps, right, that add up.
Mm.
What role does technology play in your work with stroke survivors? And are there any specific tools or devices you might recommend?
I know tech is a hot topic right
Yeah.
now. And I love it. Because I do a lot of more home-based therapy, I don't bring a lot of it's I can't afford the technology, unfortunately. Maybe one day I can. So I don't I use a lot of the technology in the hospital system, and it's amazing. and the outpatient clinics have it. So I always tell people, if you can afford it and it's accessible, try it. Why not try it?
Yeah,
So at home, really, I use a lot of electrical stimulation, portable things,
okay.
that I
Well,
can.
and it's funny to me too, some of the most simple things that I learned in occupational therapy, again, and I didn't learn till 6 months or more after, was the sock buddy. I
Mm,
mean,
the socket. Yeah.
that little PVC pipe with the rope, I still
Yeah.
use it. I still use that thing, or the little button loop.
Mhm.
Those are little things that, oh my God, make so much difference. You
Right.
know,
Right. And that's again what is kind of so fun about occupational therapy, right? Because if you want to participate in this skill, but say you don't have the physical skills to be able to, like, how are we going to get you there? We get to be creative. Like, how are you going to fly your kite with one hand? Let's adapt it and figure it out. And it's fun.
yeah, it is. It was amazing to me. I mean, somebody told me later on about electric toothbrush.
Yeah.
It's like the simplest thing, and people just don't think of it because of the cognitive issues we're having.
Right.
How do you feel about using apps or virtual reality for stroke survivors?
I think that it's great if you yourself would enjoy that. There are a lot of people that the technology, it's very difficult for them to use. It causes a lot of frustration or it makes them dizzy. That's a common
Oh, yeah.
issue that I see. But if you have access to it, again, if through a clinic or through something, just try it. You never know until you try, and it could be really beneficial. So yeah, just go for it and experience it.
I'm a great believer in the old saying, and this was an old salesperson saying, it's better to have tried and failed to fail than to fail to try.
Right.
You
Yes.
know,
Yes.
it's,
That's that too.
to me, it was like I, 6 years later, 6.5 years later, I started doing the things I used to do. It
Mhm.
looked ugly. It was horrible. But
Right.
now I can do them all pretty darn good, probably 80 to 90% well,
Congratulations. That's
you
hard.
know.
Right? That's not giving up. Even if you're not doing it exactly the way you want to, it's still important to try. You're still building those connections. A lot of my clients have that same issue is they say, but I can't cook properly right now, so I don't even want to try. And I'm like, let's spill that milk. Let's just try. We can clean it up. No big deal. But even just you trying builds those connections. So you're right. You need to just go for it and try.
Where do you, how do you suggest they find those simple tools? I mean, if they don't have an occupational therapist, or maybe it's not as good as it should be, um, can they fire their occupational therapist, first of all? And second, where do they find those tools? I mean, how do you suggest they self-advocate for that?
Yeah, it's something that it's really important, and there are always therapists. It's really difficult because when you get assigned a therapist, you hope that that they're trained and that they're gonna do everything right by you, and you don't know if they're doing right by you or not, right? Because it's not your expertise. Um,
Right.
and so, well, one thing that of course people can do, I've obviously noticed this gap in the care, right? That's accessible to people, and people should be able to advocate for themselves. So that's why I created the online community to help people progress, so people can have access to me, therapy resources to continue to progress. And I've had some people in the community who have said, I just went to OT and this is what they did with me. And I said, okay, but did they lay you down and evaluate how your shoulder is moving? And she said no. And I said, okay, well, next time you go, say, hey, can you lay me down and evaluate my shoulder, and can you tape my hand for the swelling? And I gave her a video of how to tape it, and I said, bring this to your therapist and have her tape you up. So again, like I'm trying to help bridge that gap, um,
Yeah.
and provide more access to therapists for people to help so that they can actually advocate for themselves.
Yeah, I really want to get into your online community in a little bit. And what advice do you have for stroke survivors that are struggling with their recovery or feel like they're not progressing?
Mm. Yeah, that's also common. And like we said, I earlier, is I a lot of people feel like they have these goals, but they're long-term goals, right? So that's a big aspect is, okay, well, I want to drive, but I'm not walking yet, right? So it's, and just an
Drastic.
example, a drastic example, yes. But it's setting mini goals daily, just little daily things, even if it's participation in something. I'm going to do an exercise here. Setting little mini goals along the way can always be helpful. And I always tell people, just don't give up. Like, please
Yeah,
don't give up, because I have clients that are 10 years post stroke. They didn't have therapy for 4 years. And now I'm seeing them and they're making tons of progress 10 years later. So just don't give up. The human body and brain is just capable of so much.
what it, you know, I know a lot of people that just go to therapy once a week, twice a week, 3 times a week, whatever. How important is it to extend that therapy to home practices?
Extremely important, right? We need daily activation of these pathways in our brain in order to progress. If you go once a week, it, the more you go, the more carryover you'll have of the skills, right? Or the more you participate in therapy, the more carryover you'll have. So if you go to therapy once a week, you should be asking the therapist, what can I be doing at home on the days that I'm not there? So of course, daily, the exercise programs that they give you and everything can always be helpful. But even, I always suggest even things like trying to participate. If you like to cook but you really can't right now, and your caregiver is doing all the cooking, why, like, ask if there's something that you can do. Maybe you can just wipe down the table with your good side, or maybe you can stir something, or you can just try to participate instead of sitting back on the couch and watching TV while your loved one does things. Just try to figure out some way that you can participate in the things
Yeah.
that bring you joy.
One of the funny things, again, back to simple tools. One of the funny things one of my occupational therapists did for me was they gave me a bar stool to
Mhm.
sit at the kitchen counter and to prep. I lived by myself, so I had to make my own food.
Mhm.
So she gave me a bar stool, and I was able to do that. And I got one of them cutting boards with the teeth on it, and
Yeah.
I put the little rubber mats underneath so nothing would slip. It's the simple things. You know,
You had a good
I
OT.
yeah. What message would you give to the families of stroke survivors who are looking to support their loved ones?
I would say, just again, try to become that therapeutic caregiver. Be there for your loved ones, supporting them, validating their emotions, being there for them. But do the best you can to stay educated yourself, and take care of yourself, and understand their deficits and how to help them.
Yeah.
Again, improve both of your qualities of life.
Have you run across? I've run across some other stroke warriors that become so dependent on the caregivers that they don't progress. How do you deal with that in your practice?
Mm. It's always figuring out why, right? Like diving into, why is this happening? And it could be for so many things. It could be because maybe the person feels like they can't do anything, right? And they need to be shown how much they can do. Or maybe it's an emotional barrier, that they are too upset and frustrated with the stroke that they don't want to participate. Or it could be that the caregiver is a little overbearing, and just does everything, even if the loved one wants to participate, even if the warrior is saying, let me try, and the caregiver is like, oh, I'll just put your shirt on for you, or I'll just,
Yeah.
so it could be so many different things. So I'm always trying to really get down to the bottom of, why is this happening?
Okay. What do you see as future trends in occupational therapy? Are there any new treatments or approaches on the horizon?
Yeah, of course, lots of new tech, right? Tech is the big thing, lots of new hand devices and upper extremity devices. What I would like to see, though, really more so is just more access to therapy in general, more
More access to what?
more access to therapy in general, more access to therapists at a community level, right? Because the hospitals do a great job at providing you therapy. So I would really like to see more occupational therapy in the community and more community events and engagements and things that people can participate in when they go home. Um, adaptive cycling groups in the community, or just examples like that of things that in the community OTs can help people more when they leave the hospital.
Yeah. I've heard this phrase from a lot of other survivors. We didn't know what we didn't know.
Mm.
What do you wish your patients would have known that would have made their recovery better?
Mm. Question. Yeah, it's a good question. I think if I could go back and tell my patient, because I worked in the hospital for so long, I would I would have prepared them better for going home. When you're not working in the community setting, you don't know what happens. You think that they're going home and, oh, they're in the care of the outpatient therapist now, and they're okay. Like you're just transitioning their care. So what I really would have done differently now is trying to foster that empowerment aspect from the beginning. More education, more self-advocacy for them, teaching them those skills from the beginning, because that is the basis of what's going to carry them through their, like, having a successful journey throughout.
Yeah. What's the goal of holistic, your holistic approach?
Yeah, well, my goal really, again, I left the hospital so that I could try to attempt to bridge this gap. I can't help everybody, but I'm trying to bridge the gap and provide people more therapy services in the community. So
Okay.
that's really my ultimate goal, to help people one-on-one if I can in person, and then yeah, with the online community, hopefully reach more people at, more affordable. Everybody can have access to a therapist. That's the goal.
And tell me about the online community. Can anybody join it, or is it a subscription, or?
Yeah, it's anybody can join, caregivers or people in recovery. The goal is to, there are a bunch of therapy videos, educational videos. You'll have access to me inside, so I can help guide you in your own, making sure that you're continuing to progress. And so it is a monthly subscription. It's $17 a month, but anybody who's listening here can get 2 months free. Um,
Nice. Thank you.
of course. And we, of course, in the process of recovery, I'm an occupational therapist, so I can help with a lot of things in that holistic approach, but I also know that I don't know everything. So I bring on other professionals in the neurology field for educational videos or interviews, things like that. So I'm hoping to even connect people more with neurologists to ask questions, PTs, speech therapists, neuropsychologists.
Yeah. Well, see, that's another one of those things for me. This is why I do all this Stroke Warrior Radio. Is nobody told me. I didn't find out till a year ago that I needed a speech pathologist, because I was always having coughing and swallowing issues.
Mhm.
Somebody said, you need to see a speech pathologist. I said, okay, I'll try it. And we found out I have issues. Now I got exercises to do. I got little contraptions I got to breathe in and out of, to strengthen these muscles in my left side. It's so weird that, you know, to me, I found out there's like 9 different areas of therapy, acupuncture, speech, occupational, physical, mental, the,
Mhm.
we need to communicate that better to the new stroke survivors,
Right.
you
I
know,
agree.
so they don't have to wait 7 years. Tell me
Yeah.
some of the things you do um, to teach people to progress in their therapy. I
Some
mean,
of
is you do a lot of different mobility exercises as well through the online community, or explain that a little more on what the online community actually does.
Sure, yeah. There's tons of treatment videos, educational videos on, transfers, how to properly sit to stand, exercises, to help you improve your upper extremity function. But then I also am available. I host just live Q&As where the members join and it'll be about a certain topic. Like earlier today, we just had one that was specific to improving dressing skills. So members joined on and they said, here's what I'm struggling with to put my pants on or socks or whatever. They even showed me, they showed me how they were doing it. And then I said, okay, here's what you need. You either need to work on your sitting balance or here's a technique that'll improve. So I also join live and I cover different topics, upper extremity function, balance, and I can help people individually through Zoom. It's really cool.
One of the great things I've noticed through your website is the caregiver relationship you develop online. Tell us about that.
Yeah, so I try to teach, like I was talking about earlier, teaching people to become more of a therapeutic caregiver. I really want to teach the caregivers the skills that I know, so they can help their loved one at home. So I have sections inside the community that are very specific to caregivers, teaching them the skills that they need to be more therapeutic, to take care of themselves along the way. And what's really cool is that, just like any kind of social platform, also they get to connect with one another and be there to support one another.
Is there anything you want to add that we haven't covered?
No, we covered a lot, huh? Well, we could
Yeah,
talk.
we did.
We know we could talk for days. But no, I think we did pretty good.
Well, how does everybody find out about you? And I'll post on our websites as well, but how does everybody get involved with holistic life skills?
Yep. I mean, anybody is always welcome to email me, reach out by email, and I can give you that too, to put down, but it's just Jackie, Jacki at hlskills.com. If you go to the website, hlskills.com, you can find all the information. And then, yeah, you can post the link that it's a private link that anybody who's listening to Stroke Warrior Radio, they can get 2 months free to the online community. And I hope to see everybody in there. Show me what you're working on. I'll help you to try to reach your goals.
Sounds wonderful. Sounds wonderful. Thank you, Jackie. I appreciate your time today. I hope you have a wonderful day and weekend.
Thank you. You too.
All right. Bye now.
Bye.